The health minister says he will claw back a portion of federal health transfers if provinces don't crack down on doctors and healthcare providers who charge for treatment that is medically necessary. Jean-Yves Duclos says it stems from a long-time loophole in the Canada Health Act. Let's bring in Alison Northcott with those details. Alison, what is the federal health minister proposing here?
Well, Canada's Health Minister Jean-Yves Duclos says that the government is going to crack down on these extra fees, these instances when patients have to pay for medically necessary services, which is not allowed under the Canada Health Act. So Duclos says he will be deducting money from Canada Health transfer payments to several provinces where patients have been charged fees, mainly to access diagnostic services like ultrasounds, MRIs, and CT scans. And the health minister says it's a total deduction of about $80 million. The biggest deduction is for Quebec of nearly $42 million and $17 million for BC. So the minister says that provinces need to do more to stop these kinds of fees and protect the public health care system and ensure that the Canada Health Act is being followed. He also had a warning about virtual care. That's another example of where people are being charged often to see a doctor online, often in another province. And the minister says that he's warning provinces about that practice as well, about people paying for that kind of access virtually. Have a listen to his comments this morning.
Clearly seen and felt that there is such a loophole in the Act, which has been there for many, many years. It's impacting the ability of people to have access to a surgery. It is obviously imposing fees for those who do have access to a surgery.
So Duclos says if provinces don't crack down on these private companies charging patients for virtual care, they could see further deductions to those transfer payments.
Alison, what's been the response to this potential clawback?
Well, the NDP health critic Don Davies issued a statement saying that an American-style healthcare system has been spreading across the country on the government's watch. And while they say it's encouraging that the Liberals are taking action, he said they need to do more. Quebec's health minister, Christian Dubé, he also put out a statement. He said that the private sector must complement the public network when it allows us to offer more care to Quebecers. Our agreements with certain private medical clinics during the pandemic, which made it possible to perform more than 150,000 surgeries free of charge for Quebecers, is a good example of this. But he also said that if the federal government wants to serve Quebecers, they should be putting more money into health and towards Quebecers rather than taking it away, as they're saying they will do.
Okay, Alison Northcott, thank you for the latest.
You're welcome.